Do I have your permission to share this video in my online DAT course, Corrective Techniques for Movement Dysfunction?
Yes.
We are going to perform the high-low breathing assessment. For this assessment, the patient is in the supine position, hook lying. The clinician will be positioned to the side of the patient with their hands on the sternum and upper abdomen. The participant is cued to perform normal breathing patterns. After performing the initial assessment, the patient will go through a systematic progression of exercises that increase in difficulty while expected to maintain a functional diaphragmatic breathing pattern for 5 breaths. The first progression is assessment of crocodile breathing. The patient is prone with the forehead rested on the hands. The clinician will be positioned behind the patient with one hand on the lumbar spine and one hand on the thoracic spine. The second progression is a repeat of the initial assessment followed by the quadruped position with the patient's knees under the hips and the hands under the shoulders. The clinician is positioned behind the patient with one hand on the costal angle and the lumbar spine. The fourth progression is the tall kneeling with head rotation. The patient is positioned with both knees just wider than the hips, the legs parallel and the ankles plantar flexed. The pelvis remains tilted in a neutral position. She will rotate her head bilaterally, pausing at the end range for a full breath. The clinician stands behind the patient to observe movement and breathing. She will perform 4 breaths anterior and 4 laterally. The fifth progression is standing. The patient will be assessed in 2 positions, standing in anatomical position and standing in a single leg balance with each foot for 5 breaths in each position. The clinician will move to assess the patient from different angles.